Hi, welcome to Psychology Matters. I'm your host, Dianne Bradley, and Psychology Matters is a show about mental health issues, psychology, some of those things that, we wonder about. We've talked about lots of things in previous episodes, and I hope that you've been checking those out on Facebook and letting us know what you think. And today I am so excited because I have a good old friend here with me, Trent Hughes. And Trent, you're an LPC, correct? A licensed professional counselor.
That's correct.
And I've known Trent for a few years. We've done some things together. And you do a lot of work in addiction.
That's right.
Correct?
Addiction.
So, and addiction is a big topic these days.
It sure is.
Alcohol addiction, all kinds of drug addiction.
Absolutely.
Street drugs, prescription drugs, and other things that don't fall in the category of substance
That's
addiction,
right. That's
right?
right. Process addictions.
Process addictions, that's a good way to think of it. So, how long have you been doing this? Several years, right?
I have. I've been working in the field of addiction for going on 7 years now.
Wow.
To be more specific, closer to 6. But I started just before I graduated with my master's degree, and started actually able to do the counseling right after I graduated, and I started right into the field of addiction.
And now you're clinical director of Cedar
Recovery.
Recovery of Middle Tennessee?
That's right.
Okay.
Yes, ma'am.
And what do you do at Cedar Recovery? What do you do there?
Our primary focus is working with individuals who struggle with opiate addiction. And so we work with them on a scale where if they struggle with any kind of opiates, they'll come into our facility and they meet with our doctors, and we also have counseling on site where we provide different types of clinical services for the people struggling with addiction.
You know, we've heard a lot about this in the news lately.
Absolutely.
And Tennessee has a crisis with opiate addiction,
Major
correct?
crisis, that's right.
So for our viewers, can you just educate a little bit about what opiates are? Because there are a lot of folks that may not know. There are parents that may have this concern and want to know. Could you do that?
Sure.
Okay.
So opiates are basically medications that are prescribed for individuals who struggle with pain, physical pain. And so many times people will go to the doctor and they will be prescribed a medication that helps them with any kind of physical pain that's going on in their body. And so those medications range across the board. There's different types of opiates that people use. And so once people begin taking that medication, they will take it indefinitely many times. And the tricky part is that after a short period of time, our body becomes dependent on that medication. And that's when addiction really starts to set in, when we start having that connection to the addiction piece, is when our body becomes dependent. When that happens, people can't stop taking it because of withdrawal symptoms.
Right, right. And I would imagine because they're in that cycle, that there's a psychological addiction in addition to the physiological addiction, right?
Absolutely.
Because the things that get dampened is their ability to work through things or to manage hard things, and it's easier to just fall back into taking another pill.
That's right.
Okay.
One of the things that I really, when I'm working with patients in the facility, is talking about coping skills. And as you mentioned, when you start taking opiates over a period of time, it becomes the easy way to manage any kind of emotional or psychological disturbance that's going on. And so I like to refer to it when I'm working with individuals, when you become addicted, you begin utilizing one coping skill.
Yeah.
And that is it. And so that's the go-to every time. So we have the opportunity to stabilize people who begin taking opiates and working with them once they find stability, teaching them as one component coping skills that help them manage in their recovery.
So I would imagine this is not an easy thing to recover from.
Right.
Because as a person begins coming off of an addiction, they're so vulnerable to give up
Mm-hmm.
and go back in. Do you have a lot of people that relapse?
Yes. One of the things that I find the most for people who are really sincere about recovery is they are so afraid of coming off the medication, because being sick on the medication is a terrible experience. And when they become sick, it takes them out of work, it takes them out of their family dynamic, it affects them in every way, and they start feeling pain again. And oftentimes after a period of time of using opiates, the pain is increased because of how the brain changes based on the opiate use. And so they actually begin feeling pain again. And so giving them an ability to stabilize and allowing your brain to reset, heal, it is a considerable amount of time. And so people are afraid of committing to continued treatment because they have their life.
Yeah, and I would imagine too that the pain feels bigger because they've numbed so much. You know, it seems bigger, it is bigger, and it seems even bigger. And so it's a really hard cycle to break.
It is, and oftentimes we do talk about the cycle of addiction. Relapse is very common, something that we see often. And you know, we oftentimes anticipate that occurring. We don't expect it, but we anticipate it can occur, simply because in early recovery, getting off of pain medication, if we're treating it with opiates, really helping them stabilize in their life, learning new ways to manage stress at work, learning new ways to handle their children, you know, communicate with their significant other, their spouse. It takes a while to begin developing new ways to manage that.
And I would imagine it impacts the entire family.
Absolutely.
I mean, I would imagine. I've had clients myself where that's been a case. One of the ones that I think of is Xanax.
Yes.
Many times there have been wives, married women, who have started taking Xanax maybe because they were anxious and the doctor prescribed it. And it was so good because it took, I don't know, it just took the edge and the hard parts away.
Absolutely.
And I'll never forget the case where the woman was taking 4 or 5 a day and had lost memory. She couldn't, it's like she wasn't even in her life anymore. And her husband said she's so hollow.
Absolutely.
Is that a hard one to come off of?
It is. It's a different classification of medication. It is a benzodiazepine. And like you were speaking of earlier, it is something where we talk about different types of substances, and this is certainly one that's also addictive. And you know, it's amazing. You know, you mentioned 5 or 6 of those in one day. There are people that are taking 15, 20, even 30 at one time, just to function properly and to feel normal. They don't realize they're not pursuing the high anymore. It's just about feeling normal. And so coming off of benzos is a really tricky one, particularly Xanax, because you have to actually learn how to deal with the anxiety that you're feeling, which is where the clinical part comes in, and we have the opportunity to teach people how to utilize and work with holistic skills versus medication.
So can you explain the difference between your clinic and then maybe a rehab? Because we hear rehab often. So what's the difference in what you do?
Well, this is a big debate right now, particularly in our culture, in our state. We know that there's an opioid epidemic that's going on, and one of the wonderful things, you know, you can get treatment from many places, and there's a lot of good treatment facilities out there. One of the differences that you'll find, especially around our town, is abstinence-based programs. And so when I say abstinence-based, I mean people go into the facility and they'll use different types of medication to come off of withdrawal, so that they don't get sick. It's not as bad. It's still tough. It's still hard withdrawing, even being medicated coming off of the withdrawal symptoms. But those abstinence-based programs focus on no substances at all. That means no type of buprenorphine, which is your Suboxone and things like that. They might use something else to taper them off of the medication. And people who struggle with alcohol will go in and there's no alcohol use at all. as well as other substances that people think, you know, that, oh, well, I can use this. It's not the same. It's not an opiate. It's not alcohol. It's marijuana. That's okay, right? And so your abstinence-based programs are designed to treat people without using any medication at all after a period of withdrawal and detoxification. With a buprenorphine clinic, or what we also know as a Suboxone clinic, there's a heavy speculation on what's a good clinic, what's not a good clinic, and this is where I really got excited when I had the opportunity to begin working with the population regarding buprenorphine, because I actually come from the abstinence world, and a lot of my wonderful training came from working with abstinence-based population. And I learned a lot working in that regard. So I wanted to experience another opportunity to work with people who don't have the same abilities. That's where this type of treatment comes in. What we've been working on at our clinic is really kind of joining the abstinence-based concept with the buprenorphine or Suboxone clinic concept.
Right.
So we're developing a treatment protocol, much like you would see at an abstinence-based facility, but using buprenorphine treatment as well to help detox and get stabilized.
Right. So is this a day clinic, or do they stay there overnight?
Our clinic is a day clinic.
It's a day clinic,
No one stays at this time, and so what they'll do is that they'll come in and see the doctor, meet with their doctor for the first few months for the beginning of their treatment. And we have the opportunity on the clinical side to meet with them about the second week. We'll start introducing ourselves, and we'll do history intake, and we'll begin working up the clinical side of it. We get them involved in our groups, and we also offer individual sessions. And so we have an opportunity to work closely with them. And one of the greatest things that I get really excited about is that we get to stay on the whole journey with them for longer than 30, 60, or 90
pretty
days.
great.
We get 6 months, a year, sometimes a little bit longer depending on the treatment protocol that the doctor and the patient decides on their treatment.
You know, one of the things that you mentioned was the group therapy piece, and I know how much you enjoy group therapy. That's one of the things we love to do. So can you share a little bit about what group therapy looks like? I'm imagining some people might think it looks like the AA model or the celebration recovery model. Can you talk about what your group is like?
Yes, I'm really glad you asked that question. Many times people come in to our facility and they'll say, oh, I've been to AA and NA, I didn't like it at all, you know. There is certainly benefit to the AA, the NA, Celebrate Recovery. Some people love it and it works for them wonderfully. And if they do come into our group, we recommend continuing that.
Right.
And because my primary training started in the 12-step community, it was something that I'm able to say, and we work around, we use it, we encourage, get a sponsor. We just really kind of build up, keep going. However, our groups offer a little additional help in that we do what we would call process group.
Right.
So our main focus is stabilization, and so for the patients that come in and they're just beginning an early recovery, we'll talk a lot about just stabilization, what it feels like to be clean, what it feels like to experience your home without using substances. Let's talk about developing new coping skills, and as they have a chance and get stabilized, we also have process groups and group therapy, where we have the opportunity to work a little more specifically regarding relationships, anxieties, whatever comes up in that group, we process, we talk about. And
you know, what's coming to mind as listening to you talk about that is the group that maybe you're facilitating. You have these people that are working through the hard parts, that it really is a microcosm in there with all these other people dealing with all these other hard things. It's a microcosm of what goes on outside of there in relationships outside in the world.
Absolutely.
And that must be you must get a lot of, I don't know, excitement in seeing that unfold and working with people?
One of the coolest things about that is I get really excited
Yeah.
because you get to begin seeing people not only set free from addiction, but set free from all the things that were going on in their life that caused them to become addicted sometimes in the first place. And it's wonderful to sit there and work with them and see them get it. And it clicks. And then that's when the additional, sometimes I like to call it, the real work can begin.
Yeah, yeah, because finally they're clean and they're ready and they want to hold this and grow it, right? Yeah, that's pretty wonderful.
That's wonderful.
So when you have people that do come in, would you say that you have more often than not a family member's recommended that they come in and bring them in, or individuals walk in on their own?
Yeah.
How do people find you?
Well, most times it's a little bit of both, because many times when people come into recovery, oftentimes it's because of a consequence. It's because family says, if you don't do this, then you're going to have to leave. Or someone might find themselves in legal trouble. They might find themselves getting really sick and not keeping their jobs.
Right.
And so I'd say it's a fair combination of consequence that brings them into treatment. And so that's kind of what we find, and we really just embrace them when they come in and really try to normalize the experience. And many people have a stigma attached to what addiction is. They think about the person who is, under the bridge, who is homeless, and they've turned to drugs and alcohol, and that's everyone that comes in. But I've had the wonderful opportunity to work with many people, highly educated people,
Really successful people.
really successful people,
Famous
and
people.
famous people.
Yeah.
Addiction is absolutely, it does not care.
So do you have adolescents that come in, teens?
At our facility, we do not treat adolescents.
Okay, so it's 21 and over or 18 and over?
Typically, it's we usually see 21 and older.
Okay.
And that's really up to the doctor where the prescribing begins. And because I'm not a medical doctor, I can also stay out of that part of it. I collaborate with treatment, but as far as what a patient needs, if our facility is not strong enough, we'll refer to a higher level of care. And oftentimes I'll get the chance to work alongside the doctors to make the best decision for that patient, each individual patient, as they go along.
So I would imagine that your clinic would be a great collaboration with private licensed professional counselors and licensed marriage and family therapists who run into this when we're seeing a client or we're seeing a couple and one of the couple members has got a problem, or a family member of someone that we're treating. It's good to know that we could send someone to you.
Absolutely.
So do you find yourself collaborating with other professionals?
Oftentimes we do, and the wonderful thing about that is because we offer additional clinical services, we have the opportunity to work with people who wouldn't normally send other people to buprenorphine clinics or Suboxone clinics.
Yeah.
But they're with our facility, it's in-house clinical work on a greater scale than just a support network.
Yeah, it's like customized to fit the
It
person's
is.
needs.
It is.
Does that make sense?
It absolutely makes sense.
Okay, so what would you say, just in what you're seeing, like we were saying early on, we've got an epidemic in our state, and and we're in crisis with it. So from what you're seeing with your clients, your patients, what would you say is the number one addiction coming in the door these days?
It's a great question. I would say certainly to support all of the news information and the concern, even in legislation and up into the higher ranks of our political system, it goes back to opiates.
Wow.
Opiates is one of the leading causes of deaths when it comes to drugs and addiction. And unfortunately, many people have the inability to afford or even have insurance to get the prescription, and so many times people turn to heroin.
Yeah, I wanted to ask you about that. So they start with the pain meds,
Mm-hmm.
muscle relaxers, pain pills,
Mm-hmm.
things like that.
Mm-hmm.
And then when they can't afford it,
Mm-hmm.
or
It
there's not a
stops working.
drugstore, it stops working.
Right.
Then you find them turning towards something different, and
That's
often
right.
that's heroin.
That's right. And unfortunately, heroin is really, really, really dangerous because when they obtain heroin, there's no telling what's in it. It's
Because
cut
it's
with
cooked.
all kinds of different chemicals,
Mm-hmm.
and so it's really dangerous. And you find a lot of times people are overdosing because they're taking too much, or it's laced with something very dangerous. And but because it's inexpensive, it is on the rise, and because of accessibility. And when it comes down to it, nothing matters but feeling normal.
Yeah, yeah. And I would imagine because of that, you could be very desperate when you do
Mm-hmm.
turn to heroin and you don't care what's in it at
Doesn't
that point.
matter.
You're just trying to get to the other side
That's
and
right.
feel your new normal.
That's right. And you know, that's one of the things that we really want family members to know. You know, and as much as people might not always like to hear this, but the truth of the matter is if you're a believer in the disease model of addiction, the disease model of addiction fits the criteria of being a family disease.
Mm-hmm.
Meaning not everyone's a user, but everyone plays a part in that user's addiction. And that's why it's so important to make sure that we recognize that it's not the individual that's the problem, it's the
Mhm.
addiction that's the problem.
It's the addiction that's the problem. So, do you find yourself working with family members then also to
We
help
do.
educate them? And
We do. We also offer family groups to work with families. We have clinicians at our site to also
Mhm.
do family therapy that we
Mhm.
offer in addition. And there is absolutely no doubt that when an individual who struggles with addiction comes in, we're always trying to get the family members involved. At least if they don't want to do any personal work or family work in the moment, early recovery, it's so important that they at least understand how addiction works, what it looks like. You know, when when you're in a family and you have someone struggling with addiction, you have experiences that highly affect you.
Mhm.
You have to leave your job to go
Mhm.
take care of the person.
Mhm.
It's very scary. It affects the children, you know, and so it's really, really nerve-wracking because you're a part of that whole system.
You know, we used to say when you're a family member and addiction is there, we can end up loving the family member to death. We
Mhm.
call them loving them to death
Mm-hmm.
because we're caught up in the cycle with them
Mm-hmm.
of covering up, of excusing,
Right.
apologizing on their behalf,
Mm-hmm.
cleaning up their messes.
That's right.
And we would say we're loving them to death
Mm-hmm.
because they end up counting on that.
Right. The key word that comes to mind for me when you say that is enabling behaviors.
Mm-hmm.
And family members, it benefits them so much to understand how not and how to avoid
Right.
enabling,
Right.
because loving them to death literally happens.
Yeah.
You are overboard in the way that you help and provide. And so, and you may be able to speak a little bit more than that than I would as far as those enabling behaviors and in the enmeshment pieces. But those are things that happen all the time.
Mm-hmm.
And it's important for family members to just learn, how do I set a boundary in this
Yeah.
relationship so that I don't get hurt?
Wow, that's pretty. It's pretty serious. That's pretty serious stuff. I'm wondering if you would come back again, because it feels like we just now opened up the box and there's so much more to talk
So
about.
much, absolutely.
And we would love to have you come back. We'd
I
like
would
to
be
get
honored.
into, I've got questions, burning questions about marijuana use, especially starting at a young age and
Mhm.
what happens there, and then alcoholism
Mhm.
and how difficult it is to work with that dynamic in a family as well.
Absolutely. I would love to. I would be honored to come back.
Well, Trent,
Thank
it's
you.
so good to have you here.
Oh,
it's
wonderful
great.
to be here.
And it's good to see you again. It's
Absolutely.
been a long time.
You too. Thank you so much.
So I'd like to say thank you. Thank you to our viewers. And so we're so glad that you could join us today for Psychology Matters and hear about addiction, learn about addiction. I certainly enjoyed it. There's so much that we all need to know about addiction, especially in our state. So be sure to check us out on Facebook. Let us know what you think. Give us your questions. Tell us what you think. Like us, share it, and join us again for future episodes. Thank you for watching. Hi, Dianne Bradley here. Thank you for joining us in Psychology Matters. We're really concerned about informing you on different issues, psychological issues, mental health issues, mental illness, depression, anxiety, trauma, post-traumatic stress disorder, children's issues, addiction. There's so many. And we're really interested in knowing what you think. So look us up on Facebook. Like us, share us, subscribe. Check us out on YouTube at Psychology Matters TV. And just let us know how we're doing. Let us know if you have a topic that you'd be interested in us covering. We're glad to have you. Thank you.